Hi, my name's Rebecca. I'm going to be your nurse today. Could you give me your name and your birthday?
My name is Nicholas Kenneth Connors, and my birthday is 08/22/06.
Okay, thank you. And why are you here today?
Just for a checkup
For a checkup? Good. And do you know where you are?
at the doctor's office,
Do you know what month it is?
December 11, 2025.
All right, great. Take your vital signs. I'm going to take your blood pressure. It's normal. It's 120/70. I'm going to take your pulse. It's 70 beats per minute. Your temperature. It's 98.6. Do you have any allergies?
I do not have allergies.
Okay, that's good. I just want to note that my patient's alert and orientated times 4. His vital signs are all within normal limits. And then I'm going to look at his skin. Looks good for his ethnicity, looks normal. He looks his stated age, which is 19. His face is symmetrical, eyes are bright and round. We're going to assess your hair and your head. So your hair looks clean. Doesn't look like you have any infestations or dryness or lumps or bumps. Well groomed. When you look at your eyes, I'm just going to pull down. Your sclera looks nice and white. Everything else looks pretty good here. I'm going to take and look in your ear with the light here. Ear looks good, no drainage, both sides. When you look up, I'm going to look in your nose with my light. Light looks good. Open your mouth. Let's see in there. No drainage.
Sorry, my hand turned away.
That's okay. Your pupils are equal and round, and your head is normocephalic. I just want to make sure I get a look at your conjunctiva. It looks pink. I'm going to have you open up your mouth again. And your mucous membranes look pink and moist.
It's a good thing, right?
All right, and then up your nose again, I wanted to make sure that you don't have a deviated septum. So can you take your finger and then blow in and out of one nostril? Okay, and then do the other one. You got air going in both sides? Okay, good. All right, and then one more time in your mouth. We're just gonna look at your uvula, rises and falls midline, and then your lips look pink and moist, no dryness. Test your cervical spine, and that's by moving your neck. So we're gonna have you look up, then look down, then look to the side, and then look to the other side. And it looks like that you have full range of motion with your cervical spine. Your arteries in your neck, called your carotid artery. So it's just gonna be right here. I'm just gonna feel if you have a pulse right there, and you do. And then I'm gonna listen over one of those arteries and see if you have a carotid bruit. I say no, there's no bruit. Assess your chest, which is your heart and your lungs. I'm going to listen on your chest with my stethoscope in 6 different places, okay? Take a deep breath each time. Deep breath. Okay, and go on and sit up a little bit. And then sit up straight. Same thing. Out and out. Okay, so after listening to your lung sounds, they sound clear, anteriorly and posteriorly. There's no adventitious lung sounds, which means there's no sounds that are unusual or abnormal. Into your heart now. Okay, that sounds good. S1 and S2 are present. There's no abnormal hurt sounds. I don't hear any murmurs. All right, we're gonna assess your skin. So I'm just gonna take a look at your arms. Skin looks warm and moist, equal bilaterally, no lesions or bumps on it. Looks like you have radial pulse, +2 bilaterally. Capillary refill is less than 3 seconds. Okay, let's look at your nails. So they look round and clean. And there are no signs of clubbing on your fingertips, okay?
Except
Okay, I'll have you put your head on the other side there. And then lay down. I'm gonna take your apical heart rate. So, yeah, slide down a little bit. Slide down a little more. And then just put your head here. Okay, go ahead, lie back. I'm just gonna take your heart rate right here, okay? I'll take it for 1 minute and I'll count it. I'm just gonna simulate that I'm doing it for a minute. So we're gonna say that we got 70 beats per minute, okay? Since you're laying on your back, we're gonna assess your abdomen. So we're gonna say your contour is flat to round, your umbilicus is midline and normal, your skin is even tone, everything looks normal. All right, just a couple more assessments on your abdomen here. I'm gonna listen for an aortic brewery. I'm just gonna listen here. Okay, no brewery noted. And then I'm gonna listen for your vowel sounds in all 4 quadrants, okay? Okay, you have active vowel sounds in all 4 quadrants.
all right, that's good.
That's good. Okay, I'm gonna feel your belly. I just wanna try to feel kind of like inside, so it might tickle a little bit.
All right.
Does that hurt? Any pain with that? Okay. Patient doesn't have any pain upon palpation. No lumps or bumps or masses felt. And then I'm gonna go down to your feet here. We're gonna just feel for your fetal pulses. We can feel +2 bilaterally for fetal pulses. All right, I'm just gonna check your legs for some edema. You can bend your legs. No edema noted. Looks good. Any swelling or tenderness in your legs? Okay, then I'll have you come around and just sit regular on the chair.
I feel like an old man now.
We're gonna test your strength. We're gonna go like
Sorry, I'm not
this,
supposed to say that.
and then kind of push out on my hands. This way. Push out, and then pull in. All right, let's try your strength again. So go like this, and then I'm gonna push in, and you're gonna push back against me. Push. Okay, good. Now pull. Now I'm gonna pull this way. You're gonna pull against me, and then push against me. Okay, now with your legs too. I'm gonna pull against you. Pull back. Pull. Pull. Okay, now push. Okay, now I'm gonna push in, and then you're gonna push out. Okay, and then pull in. Okay, good. So 5 out of 5 for muscle strength in your upper and lower body. I'm just gonna check your olfactory, so I'll have you smell 2 different things. You smell this? All right. This one. Okay. And then I'll have you do an eye test. So pretend that I have an eye chart here. We're going to say that you got 20 out of 20 vision with the Snellen test. And we're going to check sharp and dull on your forehead. So we'll do sharp and dull. Okay. We're going to test some of your reflexes, okay? So I'm just going to simulate this. So test your patellar. Your leg would go up. We'll test your Achilles. So it will go up. We'll look at your bicep here. And it will go up. That looks good. All your reflexes look to be intact. I'm gonna do the pronator drift, so I'll have you put your arms out like this, and then close your eyes. We're gonna watch and see if your hands drift, and they don't, so that's normal. And we didn't feel your thyroid earlier, so we're just gonna feel that. Get this butterfly piece here. Feels smooth, not bumpy, equal on each side. Okay, that concludes your test. Looks like you're very healthy. They give you a clean bill of health.